I'm Robert Mayberry. I'm a professor here at Morehouse School of Medicine. I have the Department of Community Health and Preventive Medicine, and I have the pleasure of working with Dr. Rollins, who is the director of the National African American Child and Family Research Center. And I serve as the co-lead for capacity building of the center. So, Jerisa, if you don't mind introducing yourself, if you haven't already.
Absolutely. I'm so sorry. I am Jeree Stroud. I am the co-capacity leader with Dr. Mayberry for the center, and we are so glad that you are here with us. And today we're going to go through quickly about the community pilot project program. So just bear with us, and we are hoping that you all apply. And if you have any questions at the end, we will be happy to answer those.
So, Jerry, tell me if I advance forward or you advance, you're going to advance forward for me, right?
Yes.
Okay, so this is the Community Pilot Project Program is one of our major programs as part of our capacity building efforts here with the National Center. Delighted that you guys are particularly interested, and certainly we want to give you enough information such that you can submit forward a meritorious project, which I'm sure you will do. And we're delighted that you are interested because this is the way that we build the agenda for the center. And this is the way that we make sure that we are generating the right information for programmatic changes, policy decision that would improve programs and policies decision for African-American families and children. Next slide, please. So the mission, okay, I can't, they're not moving on my side. Therese,
Okay.
I guess I can go on. So the mission of the center, as you can see, is to provide national leadership and excellence in community engaged research. And the intent here is to help improve programs that better serve African-American families and children. Next slide, please.
Mhm.
So we are mission driven here at the center. Therese, I think I'm still having, what I have in front of me, goals and objectives. So that's what I'm looking at.
That's correct.
Okay. All right. So I'm going to go through the goals and objectives of the center. I can pause at any given time. If you guys have any questions, don't hesitate to pause me. I'll let you know, we're going to do it as quickly as we can, but you can always interrupt me at any given time. So one of the goals of the center is to advance community engaged in high caliber research program focused on African-American children and family. Now, under this goal is a development of interdisciplinary research agenda that combines individual as well as multi-level approaches to advancing both theoretical and methodological innovations, primarily related to the funder of the center, which is the Administration for Children and Families. And so we're really trying to improve programs that are served or that come under the Administration for Children and Families. So this is kind of a key part of the entire center. And of course, another objective under this goal is to collaborate with community, yourself, and partners that you may bring in as well to develop and implement the research agenda. Next slide, please. The second slide, which I've already alluded to, is to build research capacity and infrastructure to conduct research that is relevant to ACF, Administration for Children and Family Programs, as well as their policy goals. And so under this objective we are trying to develop two resources and approaches that will equip the field to conduct relevant research with African Americans that are culturally rigorous, informed by an understanding of current and historical circumstances that shape the experience of African Americans. So keep that in mind as you're developing your thoughts and ideas. It really is relevant to the experience of African American families and children, and we think that this is the best way of improving that which we're doing from a research perspective. The second objective under this goal here is to provide consultation, professional development, and of course, this pilot program to support and encourage the work of researchers within and outside the federal government who are investigating these relevant questions that will come up. And the object also is to provide research mentoring. We're in the second year of a third-year Emerging Scholars Program, where we brought in graduate students and they spend 12 months with us. But we also have an undergraduate program, particularly over the summer, and this will be our second summer for our undergraduate programs. That is referred to as our Emerging Scholars Program because we're trying to expand the scholars who are doing this type of research. Next slide, please. Another goal is effective communication. We want to effectively communicate research via our comprehensive dissemination plan. And we do have a team that's involved in the center. I think they're particularly good in getting the word out. And I think they were responsible for getting the word out about the pilot program as well. And they're available to kind of disseminate research findings. So under this goal is to increase the use of research data and relevant resources. And these resources are for policy, research practice, as well as for the community audience. So let me say that again. We're increasing the use of research data and relevant resources for policy audience, research and practice audience, as well as the community audience as well. And obviously, we're trying to develop a research product resources and a comprehensive communication plan so that we can improve the understanding of the African American experience, by which we can inform policy development as well as the best programmatic response. Next slide, please, Teresa. So let me mention very briefly, and if I'm going too fast, slow me down. I think I can see if you raise your hand in the chat box. But nevertheless, let's talk about priorities for a moment. The research priorities for the center are to assess definition and measurements of the needs, assets, and experience of African American children and family, assess barriers and facilitators that impact the human experience, the human service provision too, as well as the utilization of services by African Americans. We also want to assess strategies that promote social and economic well-being of African American families and children. And last but not least, we want to make sure that we are assessing promising approaches for service provision of African American families and children, consistent with our priorities as mentioned forward and policy and response to program decision making. Next slide, please. These are our two priority areas, and they're kind of lumped together, Area 1, Area 2. Area 1, which I believe many of you are already familiar with, is the so-called TANF program, Temporary Assistance for Needed Families. But we're also interested in economic self-sufficiency and poverty alleviation coming under our priority area of 1. And the second area of priority is really early education and care. And under here is the Head Start program, but there could be other child care assistant programs that you might be interested in as well. So keep that in mind. So these are our two priority areas. And obviously your grant proposal will be evaluated based on how well you address these priorities. Next slide, please. Let me mention briefly here our guiding principles. We believe in scientific rigor, obviously, and one way of thinking about scientific rigor is whether or not you can carry out a project that is consistent with best practices, best research methodologies. And another way of thinking about this, with your findings and the way that you conducted your research hold up in the public forum of critique by researchers. So if you've done your research, you think you've been particularly rigorous, then the public forum will likewise nod forward and saying it is nicely done. Plus, it will have been done in a way that it could be repeated and get similar results. So that's an indication of what rigor means. Another principle is our ethical principles. And so we'll talk more about this as we move forward. But we also are interested very much in the relevance of your research. As community-based organizations, you have independence in how you move forward in your research. And so we might have some advice here and there as you ask us, but we are particularly interested in how researchers run forward independently, not influenced by professional biases, administrative biases, and so forth that conduct in the conduct of that research. And obviously, we want our research to be transparent, such that anyone can review it, discuss it with us, and move forward accordingly in these programs and policy decisions. Next slide, please. So a brief mention here of community values, and I just wanted to emphasize them and pretty much stay close to the text here. One of the community values is all people have the right to political, economic, cultural, and environmental self-determination. The community has the right to participate as an equal partner at every level of decision-making, and that might include needs assessment in the planning of research and the implementation and/or conduct of research. But we also want our communities and other partners to be participatory with us in the evaluation of our research. Another value here is the principles of individual and community informed consent should be strictly enforced. And we'll talk a bit more about this as we get to Institutional Review Board for the Protection of Human Subject training in just a moment. Continuing on with community values, we believe that research processes and outcomes should benefit the community. Community members should be hired and trained whenever possible and as appropriate, and research should help build and enhance community assets. So we really want research, community asset-driven research by which the community brings forward its own expertise in moving forward. Another community value is that productive partnerships between researchers and community members should be encouraged to last beyond just the life of the project. These projects will run 12 months, but we are engaged in building partnerships, and hopefully you'll be engaged in building a partnership that lasts beyond a single 12-month project. And that's relates to a number of issues, not only the capacity that we're trying to build nationally, but also the capacity to sustain this type of research in the future as well. And last but not least, I think this is the last values, is that community members should be empowered to initiate their own research. And this is a key component here. We want that research to address needs that are identified by community organization, community members, and so forth, because we think that as particularly relevant research, and oftentimes this type of research has a way of sustaining itself beyond just academic involvement. Next slide, please. So I probably have alluded to this already, but just to restate the purpose of the pilot program, it is designed to build the community's capacity to conduct research that is both responsive and relevant to the well-being of African-American family, children and families. Just a restatement there. I'm going to shift now into the pilot project itself, which is to be conducted in two phases. The first phase of the pilot project program, which runs from September 2025 to February 2026, has to do with the deliverables that comes in, and that deliverable is a one-page summary of your proposed pilot project. After that, we anticipate that there will be human subject research training, and obviously there will be human subject research training and Institutional Review Board for the Protection of Human Subject review prior to any research being conducted. So the submission of the study protocol to the Morehouse School of Medicine, or if you are affiliated with any other academic institution, to the Institutional Review Board is critically important to make sure that we are moving forward as intended, as any academic institution want to do, to protect human subject, those who are participating in your research. Next slide, please. Phase 2 of the research is also about deliverables as well. And in phase 2, which covers the period March 2026 to August 2026, a 12-month period, oftentimes run very quickly. You're really in the data collection. So data collection of your pilot projects, and data collection could take on a number of different methodologies and strategies, including surveys, focus group studies, as well as key informant interviews. So it's left up to you how you conduct the research. but we wanted to stay as close to these phases as possible. You're also in your presentation phase here. Presentation of results becomes critically important to your audience, but you'll have a chance to participate in our annual meeting of the center, which you'll get notice of in subsequent time. There's also a brief report of your results and then a description of the next steps. Hopefully, the research that you will conduct over the 12-month period of time will guide you forward, take you forward to continue the type of research that you're interested in doing, capable of doing, involving your community appropriately. And as a result, it continues to help us build what we're trying to do, which is the scholarship necessary for policy decision and programmatic improvements as well. Next slide, please. Let me mention this because this becomes critically important as you get more engaged in the conceptualization of your research project. You might have questions about research design issues, data analysis issues, and so forth. I'd like for you to take advantage of our research support. You might notice here in my introduction is that I mentioned Professor of Community Health and Preventive Medicine. All of us here at Morehouse School of Medicine wear a number of hats. And one of my hats is Director of the MSN Research Design and Biostat Core. In that RDB core, there are senior biostatistician, data analysts, and so forth, who can make themselves available to you to help you to design, but can also collaborate with you in terms of support and data analysis, as well as the interpretation of data as well. So we consider this as part of your collaborative team as you need it. So we're here to collaborate and support you through consultations, either as a group consultation or as one-on-one consultation. And as I indicated, we are available to you in terms of helping you with biostatistical analysis and other analytical support. But I will also mention, and you'll get to know them as well as time goes forward, is that we have a key group of content experts, and we refer to them as the Center Core Investigators. They have our advanced knowledge in the priority areas that have been mentioned, and the federal programs that we're helping to improve and help policy decision-making in that context. And so they're available to you as you get into the field or as you're conceptualizing your research project is forward. So you can take advantage of them as you go forward. Next slide, please. All right, I might speed up just a little bit just to get us through here, but I want to mention very specifically here the eligibility requirements. Eligibility to apply for the Community Pilot Project Program is limited to community-based organizations, and those community-based organizations are described as not-for-profit organization under Section 501c3 of the Internal Revenue Code. And if you are a CBO thus designated, you would know that right off the top. CBOs who are primarily, we are also interested in CBOs who primarily serve African-American children and or families. And so this is something that we emphasize. It becomes critically important because we see the need, but we also see the need for unique scholarship to improve the well-being of African-American children and families, and such you become a part of that as a pilot project grantee. Next slide, please. Now we're going to get a little bit more into the administration arm of the program and the funding that will be available to the successful applicant. We are looking forward to funding a maximum of 3 awards up to $20,000 over a 12-month period of time beginning September 2025 as mentioned. And now let me just mention a bit about the budget. The budget may include non-administrative personnel, so salary and fringe, consultant cost, supplies, and other expenses that you deem as important. But keep in mind that the budget cannot include capital expenditures for equipment, and obviously we cannot pay also for rental costs of all site facilities. So keep that in mind as you contemplate developing your budget. Next slide, please. You have likely already gotten some of this information since you're here with us today. There is an intent to submit letter of intent to submit gives you a chance to submit to us and beginning to think about the entire process, as well as the content of your proposal as well. So it's a letter that has the title of your project, a description of the community identified issue that you want to address, as well as what priority area you have chosen for the type of research that you want to pursue. The intent to submit is not required, but we do strongly recommend that you do so. It can give us a way of getting kind of set up to review as expeditiously as possible the grant proposals that come in. And so if you're interested, we really would appreciate your submitting that intent to submit as soon as you can. Of course, the deadline for that intent to submit is March 14th, which is coming up in a few days. And you can submit that directly to info@naacfrc.org. Next slide, please. Now, these are the application requirements, and let me go through them as quickly as possible. I think we're doing pretty good on time. I want to make sure that I leave enough time to get to know who you are, and of course, answer any questions that you might have. The cover letter includes there is a cover letter that's part of the requirements. And of course, the proposal narrative will include a description of the community served and the priority areas that you would like to address in your proposed pilot project. Give us an explanation also of how the pilot project will help address the selected priority areas as I've mentioned. Also included in the narrative is a description of your organizational experience and capacity to address the priority areas. And last but not least, a description of your interest in conducting community-engaged research. Next slide, please. Continuing on here with the requirements, it was just a brief mention, but I mentioned them again. To include your budget and your budget justification, a copy of your 501c3 status. We would like to have you include the resumes of your team. And if you're working with academic members out there, faculty members at other institution, or even this institution, a letter of commitment as well as a bio sketch from the faculty member will be greatly appreciated. The deadline for the application is coming up in about a month, a little bit more than a month's time. Deadline is April 18th, 2025 at 5 p.m. Next slide, please. So wrapping up, or getting close to wrapping up, to give you a sense of how the proposals will be evaluated, because here are the selection criteria and the points that will be assigned to each section of the proposal that you will submit. So there's a background component here for 25 points that would kind of describe the extent to which the description of the community and the research priorities demonstrate your understanding of the issues, its causes and possible solution, and a reasonable rationale for a pilot study to address the identified priority areas of the center. That's a whopping 25 points. Next slide, please. The next section and review criteria here, selection criteria, will be experience and leadership. We'd like to know a bit about your organizational history and its leadership, and that leadership that's needed to address the identified research priorities, and how this research and your prior experience and track record is being used here to address the priority areas. So your organizational history, the leadership needed to address the priorities, as well as a track record of having addressed and whatever experience you might have in addressing the research priorities as indicated. Next slide, please. I've alluded a bit to research partnerships, but let me just mention it again. We're looking for a description of collaborative partnerships with the communities and or academic institution, even if they're here at Morehouse School of Medicine or elsewhere. And it's a description of the partnerships that have abilities in community engaged research and ability to address the research priorities. I don't want to overemphasize, but the commitment of research partners are critically important too. So in addition to addressing the research priorities of the proposal, also emphasize the commitment that all partners have to participate in all project-related activities. Next slide, please. Let's see, did I mention partnerships already? A description of collaborative partnerships with the community and academic institution. That seems like a repeat.
Yeah, you're on organizational capacity.
Okay, that's on my end. That didn't go slow. All right, I thought I was about to repeat, but thank you, Jerice.
You're welcome.
Yeah, see, that's why we work as a team around here, you know.
Absolutely.
Because I drop the ball any given time. But in any case, we're here. Let me mention the organizational capacity. We're interested in a description of expertise, ability, and experience of the research team. And obviously, a mention of the time commitment and effort to conduct a research project. So that is a nice way of us describing organizational capacity, because the time commitment as well as the expertise, ability, and experience becomes critically important and giving us a sense that your organization truly does have. If we're not familiar with your organization, it gives us a sense that you truly have the capacity to carry out this type of research. Next slide, please. All right, getting close to wrapping up here. All right. So there's an onboarding process here for all successful grantees. And it starts with a vendor registration as well as a W-9 form. And these forms are required to be set up in our payment system for future payments. And then there is a sole source form that will be completed by MSM team members, the administrators of the center as well as institution members that need to be involved. Next slide, please. And then there are agreements that will be developed along the way to the successful grantee as well. So MSM and organization will agree on the scope of work. MSM and the CBO must agree on the budget and its budget justification. And there's also the standard MSM consultant agreement will be routed internally before sending to the organization. And MSM will email that agreement to the organization main contact for review and signature. That is completes the onboarding process. Next slide, please. And this is just to mention, because if you have questions about payment processes as you get into your work as a successful grantee, you'll always have someone to pick up the phone or send an email to ask. But the organization will submit invoices, your organization will submit invoices for completed deliverables as described earlier. Morehouse payments are usually made within a 30 to 45 days once it is received through accounts payable. Our accounts payable office, and we will try to stay in touch with you, or we will stay in touch with you to keep you updated on the payment process and the status of your invoice and the status of your payment going forward as well. And then last but not least, I think the next slide is the final slide. And it's just an indication again that the Community Pilot Project is funded by this center, the National African American Child and Family Research Center, funded by the organization that I mentioned before, Health and Human Services, Administration for Children and Families, and the Office of Planning, Research, and Evaluation. We are Morehouse School of Medicine, the lead organization here, and we're delighted to work with our fearless leader, Dr. Latrice Rollins, who is our principal investigator and director of the center. So I think that completes all of the slides. Jerice, thank you so much for getting me through this.
welcome.
Hopefully it did not take too much time, but we are now open to any questions that you might have, and we'll try to answer them as expeditiously and quickly as possible, but there's no rush. We will stay on here as long as need be.
Before we start, Dr. Mayberry, make sure you take down your screen. You can stop sharing on your side as well.
I think I can handle that.
And then while Dr. Mayberry is taking his screen down, I do want to let everyone know that we will be sending out the recording to everyone. I saw that in the chat box. People were asking would they receive a recording of the presentation. Yes, we will. We will be sending out a recording for the presentation. I also see in the chat, Dr. Christopher, would you like to ask your question?
Sure, guys. Good afternoon.
Good afternoon.
There we go. Good afternoon. I am on full speed. We are gearing up towards Pi Day happening this Friday and Saturday here in the Atlanta area. So it's been a doozy, for lack of a better term, but a good doozy, a doozy nonetheless. But I just had a quick question as it pertains to the grant and like the research and all of the things pertaining to it. Would an after-school program and or out-of-school time program be a good fit for a research proposal such as this one? So one of the things that we do here at Math and More is provide math intervention services via tutoring, one-on-one and small group, after school, summertime, spring break. Would that be a viable stretch of proposal or application resource, I guess, for lack of a better term?
And the answer to the quick answer to the question is yes, it is not a stretch. In fact, we funded after school and summer programs before, so we would look forward to continuing to do so. So yes, that is applicable under this grant program.
And then I guess the second part of that is I do see people from all over on this call. When it comes to the selection criteria, I know that you all said 3 organizations, with Morehouse being based here in the Atlanta metro area. Is there priority given to those community-based organizations doing the work within the area of reach? Or is it just going to be based off of the selection criteria, strongest application, rubric, and all of that other good jazz?
Selection criteria, strongest application. Keep in mind that this is a national center, so we are interested in funding projects at the local level, the regional level, as well as the national level, because one of the reasons for having this center and the reason that the center fares so well in funding is that we really are trying to build a national group of research scholars that are capable of getting the work done and capable of getting unique work done that feels the need for our ability to inform policy and programmatic decisions. So that's a good question, great question to ask. So thank you.
All right, I appreciate that. Thank you all so much, and you all have a wonderful rest of your day.
Okay.
Yeah.
And did you say a quick bit about your program again?
Oh, Math and More is an acute mathematics firm simply aimed to debunk the myth of I'm not a math person within the communities that it serves. So we do that in 2 folds. We either provide tutoring to a K-12 scholar that's enrolled in a math program or a math class, or we provide tutoring by way of professional development to the adult delivering math instruction to ensure that they can deliver quality instruction. Because the research does show that if a teacher who is timid and in delivering math instruction delivers that same timidity or that same hesitation towards the content to the student that they are teaching. So that's the 2 ways that we do it. And then we also do it by building capacity within the community. So we literally will be holding a math community event this Friday and Saturday. The Friday one is on Pi Day. This Friday, which will be housed in Atlanta. Both of the events will be housed in Atlanta, but one is going to be at Krog Street at Brew Dogs. It's a STEAM sort of networking event where STEAM educators are coming out, sponsored by Brew Dogs. And then Saturday will be a community event where parents, scholars, and the like can come out and explore the constant pie via just engaging in the math in a fun way. So there's pie eating contest, pie decorating contest. I'm actually produced and published a little workbook for the scholars to participate in. So should anybody be in the Atlanta area, I'll drop the link in the chat if that's okay. And then you all can just register as you see fit. Both events are free. You just pay for what you want to pay for.
Wonderful. And thank you so much for sharing it with us. We appreciate that. So
No problem.
quite impressive.
Thank you all so much for having me.
Let's see, are there any other questions?
Can I ask a quick question?
Absolutely.
Yeah,
Yep.
sorry, I'm unable to turn my video on at the moment.
I can
but
see
I
your
had a
name
question.
right here, Gabrielle.
Yes.
Holt.
Our organization works with both like U.S. citizens in Aurora and Denver, Colorado, but also with refugee communities from East Africa. Would outreach to the East African refugee community in the Denver area qualify for the grant, or should we focus more on the historically underserved Black communities in Denver for the grant application?
That is a wonderful question, and we might have to get you additional information if need be, but let me give you my perspective. If the group in which you are serving are eligible for programs that fall under the areas that we mentioned prior, then you would be eligible to submit forward.
Okay, perfect. Thank you. That's helpful.
Okay. Thank you for the question. Let's see, anyone else? Or any introductions? Okay. Carmen, what's the name of your organization?
Hi, good afternoon.
I'm not necessarily calling on you. I just looked up and saw your name right there. What's the name of the organization? Google. Just introduce yourself.
I am
Thank you.
at Lawnside Public School in New Jersey.
Okay, very good. Let's see who else name just popped up. There's a Isaiah. What is the name of your organization?
Good afternoon. I'm Isaiah Zimmerman. I'm the Community Support Director with Clayton County Community Service Authority. We provide assistance to low-income families. We have 5 Head Start programs too as well. So I have a couple of my colleagues here too on the line. We're very interested in this project. We do several projects with Morehouse School of Medicine with Dr. Langley, Dr. Irving, with the community healthcare worker side. So we are very, very familiar with Morehouse School of Medicine, and we're looking forward to presenting a proposal to kind of work with some of our families that we have that we serve already here in Clayton County and also in Rockdale County.
Thank you for coming on board with it. Dr. Langley is one of my heroes here. She's been around for a moment and always do great work. So if you're participating with her, you're participating with her, you're top notch already.
I appreciate it. We're actually going to see her real
Absolutely.
soon. We got a big event on April 12th. So yeah, we're very excited about that event.
Wonderful, wonderful. And let's see who else is here. Nikki Conyers.
Hi, everybody. I actually work with Gabrielle, and I'm the executive director of a nonprofit here in Denver called Montessori on Wheels. And we actually have a mobile learning program that increases access to Montessori education to families in Black communities that historically and currently don't have or are in early childhood deserts.
Okay. Let's see, thank you, Nikki, appreciate that. I think we've gotten everybody in. Oh, I see a Kay Allen. Is that someone we missed? If you're still on.
Yes, I'm still on. I was just stating that I work alongside with Mr. Zimmerman. So
okay.
Yes, I'm the family community partnership coordinator for Head Start.
All right, that means I called on you a second time, but thank you. Let's see, who else? I think that's everyone. If there's someone else who I do not see and you would like to introduce yourself, by all means do so. If there are other questions related to any of the content that we've shared today, by all means, go ahead and do so. We still have a little bit of time. So we'll wait to see. Jerice, is there anything else in the chat that I don't see that we might need to address? Okay, Jerice might be off. Okay. Well, again, let me thank you for your interest in the National African American Child and Family Research Center, headed by Morehouse School of Medicine and Dr. Robbins. Again, I'm pleased to work with her. I'm quite impressed with how the center has come up and how we're moving forward, both in the pilot projects, but also in the other programs that we have as well. So I'm particularly very excited about your interest in the center, looking forward to your applications. If there are any questions that you might have after today, don't hesitate to contact me, contact Jerice, or I see Michelle is on board. I see Michelle is, at least Michelle, I see your name. Michelle, would you like to introduce yourself? If you're still on?
Yes, I'm sorry. I am Michelle Meadows, Research Administrator with Dr. Rollins, and I also work with the payments and invoicing. So I will be the one that you email your invoices to if you are selected. If you have any questions regarding invoices and payments, feel free to reach out to myself or Dr. Rollins in regards to that.
Thank
And
you.
good luck.
Thank you, Michelle. Well, again, thank you for your interest, and I'm excited about the community pilot projects, but I'm excited about community-based organizations that want to be involved in these issues that the center is championing. So thank you very much for your interest. We look forward to your application, and we would look forward to working with you and collaborating with you in the future. And if there are no more questions now, if you have some afterwards, contact me, Michelle, Jerice, or anybody related to the center, and we'll try to get back with you as soon as possible. So thank you so much for your interest, and look forward to your application coming through and the opportunity of working with you in the future. Enjoy the rest of your day, and thanks for joining us.
Thank you so much.
You're quite welcome.
Thank you.
Quite welcome.